Non-communicable diseases, or NCDs, are chronic conditions that cannot be transmitted from person to person. They are primarily driven by lifestyle factors, genetic predispositions, and environmental exposures. Major NCDs include cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Key aspects of NCD prevention and control include 1. Risk factor reduction, addressing modifiable risk factors such as tobacco use, unhealthy diet, physical inactivity, and harmful alcohol consumption through population-level interventions and individual counseling. 2. Early detection and screening, implementing screening programs for early detection and prompt management of NCDs like breast, cervical, and colorectal cancers, as well as monitoring risk factors like hypertension and hyperlipidemia. 3. Disease management, providing comprehensive care and support for individuals living with NCDs, including medical management, rehabilitation, and palliative care services. This involves a multidisciplinary approach involving healthcare providers, patients, and caregivers. 4. Health promotion, implementing population-wide interventions to promote healthy lifestyles, such as campaigns encouraging physical activity, balanced nutrition, and smoking cessation. 5. Policy and environmental changes, advocating for and implementing policies and environmental modifications that create supportive environments for healthy choices, such as tobacco control measures, taxes on unhealthy products, and urban planning for active transportation. Engaging communities in health promotion efforts is crucial for sustainable and effective public health interventions. Key aspects include 1. Community mobilization, fostering community ownership and participation in identifying local health priorities, developing culturally appropriate interventions, and implementing sustainable solutions. 2. Capacity building, equipping communities with the knowledge, skills, and resources necessary to address their health needs through training, education, and resource allocation. 3. Community-based participatory research, involving community members as active partners in research processes, from identifying research questions to data collection, analysis, and dissemination of findings. 4. Community health workers, training and deploying community health workers who are familiar with local contexts and can serve as bridges between communities and formal healthcare systems. 5. Intersectoral collaboration, engaging various sectors such as education, agriculture, and local government to address the broader determinants of health through coordinated efforts. Ethical considerations are fundamental to public health practice, as interventions often involve balancing individual rights with collective well-being. Key ethical principles include 1. Respect for persons, respecting the autonomy and dignity of individuals, protecting their right to make informed decisions, and ensuring informed consent in public health interventions. 2. Beneficence, promoting the well-being of individuals and communities through actions that maximize benefits and minimize potential harm. 3. Justice, ensuring fair and equitable distribution of public health resources, interventions, and services without discrimination based on factors like socioeconomic status, race, or gender. 4. Privacy and confidentiality, protecting the privacy and confidentiality of personal health information while balancing the need for public health surveillance and research. 5. Ethical decision-making frameworks, utilizing ethical frameworks such as principlism, utilitarianism, and casuistry to navigate complex ethical dilemmas and make well-reasoned decisions in public health practice. Public health agencies are organizations at the local, national, and international levels responsible for protecting and promoting the health of populations. Key functions of these agencies include 1. Disease surveillance and monitoring, collecting, analyzing, and disseminating data on disease patterns, risk factors, and health outcomes to inform public health policies and interventions. 2. Health promotion and education, developing and implementing campaigns, programs, and resources to promote healthy behaviors, raise awareness about public health issues, and empower individuals and communities to make informed choices. 3. Research and knowledge dissemination, conducting and supporting public health research, synthesizing scientific evidence, and disseminating findings to inform practice, policies, and decision-making. 4. Emergency preparedness and response, developing and coordinating plans and protocols for responding to public health emergencies, such as disease outbreaks, natural disasters, and bioterrorism threats. 5. Policy development and implementation, informing, developing, and implementing public health policies and regulations at various levels of government based on scientific evidence and best practices. Public health encompasses a diverse range of careers and specializations, including 1. Epidemiologists study the distribution, patterns, and determinants of health-related events in populations, informing disease prevention and control strategies. 2. Health educators and promotion specialists develop and implement programs and campaigns to promote healthy behaviors, raise awareness, and empower individuals and communities. 3. Environmental health specialists investigate and address environmental factors that impact human health, such as air and water quality, food safety, and hazardous materials. 4. Biostatisticians apply statistical methods to analyze and interpret public health data, contributing to research, surveillance, and policy development. 5. Public health administrators and managers oversee and coordinate public health programs, services, and organizations, ensuring effective resource allocation and implementation. 6. Global health specialists work on international public health initiatives, addressing global health challenges and promoting health equity across nations. 7. Public health researchers conduct research to advance knowledge, develop interventions, and inform evidence-based public health practices and policies. The epidemiology of non-communicable diseases involves studying the patterns, distribution, and determinants of chronic conditions like cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases. Key aspects include 1. Risk factor surveillance, monitoring the prevalence of modifiable risk factors such as tobacco use, unhealthy diet, physical inactivity, and harmful alcohol consumption, which contribute significantly to the development of NCDs. 2. Burden of disease studies, assessing the impact of NCDs on populations through measures like disability-adjusted life years, mortality rates, and years of life lost, to inform resource allocation and prioritize interventions. 3. Cohort studies, conducting long-term prospective studies that follow groups of people over time to identify potential risk factors and predictors of developing NCDs, providing insights into disease etiology and progression. 4. Evaluation of interventions, assessing the effectiveness of public health interventions, policies, and programs aimed at preventing and managing NCDs, such as tobacco control measures, nutritional labeling, and screening programs. 5. Spatial epidemiology, analyzing the geographic distribution and clustering of NCDs to identify potential environmental, socioeconomic, and cultural determinants influencing disease patterns. Environmental health is a branch of public health that focuses on understanding and addressing the impacts of environmental factors on human health. Key aspects include 1. Environmental exposure assessment, identifying and quantifying human exposure to various environmental hazards, such as air pollution, water contamination, toxic substances, and radiation, through monitoring and modeling techniques. 2. Environmental epidemiology, studying the relationships between environmental exposures and health outcomes, providing insights into disease causation and informing preventive measures and risk management strategies. 3. Environmental risk assessment, evaluating the potential risks posed by environmental hazards and developing strategies to mitigate or eliminate those risks through regulatory actions, policy interventions, and public education. 4. Healthy environments, promoting the creation and maintenance of healthy built environments, including housing, urban planning, transportation systems, and access to green spaces, which can have significant impacts on physical and mental well-being. 5. Climate change and health, addressing the public health implications of climate change, such as the spread of vector-borne diseases, heat-related illnesses, and the impacts of extreme weather events through adaptation and mitigation strategies.